mga ka-webinar and welcome ulit sa ating Nutrition and Health Webinar Series. This community service is brought to you by Pharmacia Jimenez Corporation with today's sponsor Oranim Terra Mouthwash and Nimit Alcohol. I'm Grace. I'm going to be with you for the next hour as your moderator for this afternoon webinar. Ang episode natin ngayon ay magbibigay ng focus sa safe and virus-free dental visit, most especially ngayong pandemic. Alam nating lahat na ang importansya ng oral health for our overall well-being, pero para ma-achieve ito, we need to practice good oral hygiene by brushing our teeth, flossing, and mouth rinsing. However, though, there are dental conditions that would require a visit to dentists in their dental clinics, of course. And with the existing COVID pandemic, meron tayong mga pangamba o worries na baka ma-expose tayo sa sakit or infection at doon tayo natatakot pumunta sa ating mga dentista for an oral prophylaxis or other dental procedure. Para ipaliwanag sa atin kung ano ang mga pagbabago that we should expect when we make a visit to our dentist, at para tanggalin ang mga worries na nabanggit, we are so privileged this afternoon na makakasama natin ang isang subject matter expert pagdating sa dental hygiene at sa dental medicine. He had his Doctor of Dentistry in Central Escolar University in Manila. He completed the UCLA Continuing Education Curriculum for Postgraduate Program in Aesthetic Dentistry. He is a member of the Philippine Dental Association and is a fellow of Pierre Fauchard Academy, and he is also fellow of the International College of Continuing Dental Education. He is the past president of Laguna Dental Society, and he is the president-elect of the Philippine Academy of Aesthetic Dentistry. Let us all welcome and good afternoon, Dr. Dr. Ricardo Ricky Gatbonton. Thank you, Doctor, for joining us this afternoon.
Thank you. Thank you very much. Good afternoon, everyone. Thank you, Dr. Grace and Pharmacia Jimenez for having this 13th series webinar of Oranim and their good products as well. So I'm very much privileged sharing this knowledge and information to my fellow dentists and allied medical services or profession as well. Okay, so I'm here to give you some information, tips about how to have a safe and virus-free visit to dentistry or to dental clinic. Okay?
Thank you, Doc Ricky. So, nag-invite din tayo, Doc Ricky, from the consumer side naman, who will share her actual experience as she has been an ortho patient for the last or more than 3 years now. She's actually 21 years old and an HR assistant currently. Magandang tanghali sa iyo, Miss Eileen Joyce Balbayra. Pakibate naman yung ating mga FB Live and YouTube Live viewers. Nakamute si Miss Eileen, pa-mute.
Hello, good afternoon, Dr. Grace, Dr. Ricky, and Mr. Rene, and to PJC family and to our Facebook Live viewers. Good afternoon po.
Thank you, magandang Eileen. Salamat sa iyong pagbati dahil napapanood tayo via Facebook Live sa ating mga FB Live viewers. Ngayon, kindly post your comments below. At ang ating subject matter expert will try to answer some of your questions. Ulit, ini-encourage namin kayo na mga FB Live viewers to include your comments kung anong topic yung gusto nyong pag-usapan sa susunod na webinar na ating kukunin na subject matter expert sa mga susunod na episodes ng Nutrition and Health Webinar Series. Ini-encourage din namin kayo, mga live viewers, na mag-participate sa ating quick survey. Napakisabi lang po, kindly just put yes if you find this topic relevant to you and no po if you find this not relevant to you. Para sa mga magpa-participate po sa ating webinar ngayong afternoon na to, pag nagtanong po kayo at napili po ang tanong nyo, you have a chance to win a special gift pack from Oranim, Thera Mouthwash, and Nimit Clean Alcohol are sponsors for this afternoon. So, para magtuloy-tuloy na po tayo, balik tayo ngayon. So, let's proceed to the discussion. I'd like to ask Dr. Ricky. Dr. Ricky, ano po ba yung mga dapat nating makita na ine-expect ng mga bagong protocols na sinusunod ng mga dentist and dental clinics ngayong may COVID-19 pandemic, lalong-lalo na sa paggamit ng dental equipment and devices to ensure a safe and virus-free dental visit sa mga pasyente at sa mga hygienist din po. Yes, Dr.
Okay. Thank you, Dr. Grace. Well, basically, it's really a good question for all of us practicing dental profession, because kailangan tayo ay equip ng mga importanteng instrumentation, machines before we open or we reopen our clinic. So as I've said, before we go to a certain clinic, hindi naman na magiging choosy tayo, but we have to know some protocols and guidelines that we should know. That where are we going is that it is safe and this is really virus free. So dapat meron tayong mga aerosol machine, we have disinfecting or misting machine, the UV or what you call this, air filter with HEPA filter, I should say, and a lot. So pero pinaka-importante sa lahat, the basic, ito lang ang pwede kong sabihin, which is always na pinapractice natin before pa the pandemic came, is a good oral mouthwash, because I really believe na before and after procedure in the dental patient natin, kailangan magkakaroon ng isang mahusay na panglinis ng bibig or pangmumog. Which hindi naman dahil I was invited by Pharmacia Jimenez, but I've been using Oranim mouthwash because I really believe on the product. Because of this, talagang marami akong good feedback from my patients. So Oranim is always my partner in mouthwash. Good afternoon, everyone. So I'm here to give you how to have a safe and virus-free dental visit. Yeah. So first and foremost, we have to know what is all about this COVID-19. Yeah. Are you familiar with this scenario? What do we need now? Are we protected from this invasion? We are always at risk. We need a barrier and get more familiar with it. So this is the COVID-19 virus that it's really confronting walang pinipiling edad, and even gender. And whatever race you belong, ang COVID-19 is within our midst, So therefore, we have to be very careful, and we have to know some procedures like dental isolation, which I should say that it is a recall for safety and virus-free dentistry. Okay. So the one who guards his mouth protects his life, right? That's why we have to guard your mouth. And so therefore, in isolation, I have to give you and ask Mr. Webster that the definition of isolation, it is a noun, which is state of being alone or away from others. But in dentistry, it is a separation of a tooth or a group of teeth from the oral tissue and saliva by use of a dental dam, using a cotton rolls and other means to improve access, visibility, and control moisture contamination, while restorative or operative dental procedures. So, dito papasok yung isolation sa ating gagawing topic for today. So what is the purpose and objectives of this lecture? First and foremost, we have to know the different methods of tissue management or isolation technique, and to become updated of the materials and instruments needed during this procedure, to create awareness of the possible effect and outcome on rubber dam or using a rubber dam, and to discover a better way and more convenient approach in dental placement. And so tissue management is the answer for this, because it is really an important procedure with fabricating direct and indirect restoration. What is direct and indirect restoration? The direct restoration is the one we do directly on the enamel surface of the patient. Para lang dun sa mabilisang meaning nito, yun yung ating mga direct veneers, direct restoration. But the indirect one, it is being fabricated outside the mouth of the patient. It is being sent to the laboratory. Yun yung mga indirect. And relatively very simple and effective. So when dealing with the healthy gingival tissue and properly placed in a short distance into the sulcus, that is the proper way for tissue management. Yeah. What else? This is also some techniques that has to be proven relatively and predictable, safe and efficacious. But again, there's scientific evidence that has established that one method is superior on the other one. So hindi natin pwedeng sabihin, o yung rubber dam lang ang pinaka-the best, o paggamit lang ng mga isolation tissues and instrument is the best. So no one has been scientifically been evident and established about the superiority of one technique over the other. So we will see more on this because we have to know the different methods of dental isolation. Since we are focusing now on the isolation, I will be giving you some methods, but I will be concentrating particularly using the rubber dam. Physico-mechanical method is one, and then chemico-mechanical is a combination of the chemical and the physical method. Also, we need to know the chemical method alone, rotary curettage using a tissue trimmer in high speed, and what else? Electrosurgical method, surgical method, recent method, or lasers. But I will be focusing more on the physico-mechanical method. So para wag tayong antukin pero mas maging lalo pa tayong mag-concentrate doon sa ating discussion this afternoon, I will be dealing more on the physico-mechanical method. So what is this? This involves mechanically forcing the gingival tissue away from the tooth surface laterally and apically. So we are the one controlling, no? We are the one controlling how to make the gum separated dun sa tooth or teeth na ina-isolate natin so that we could have a better access on the procedure that we are taking in. So we can use only when there is a normal healthy gingiva or attached gingiva. That is also one good thing. And retraction is attained to a lesser extent. Meaning you should know when to start and when to stop the procedure. So these are the example of the physico-mechanical methods. No? We are using the retraction cord, rubber dam and clamp, and the temporary crown. So usually, if we are doing some cosmetic procedure, which this is really my forte, cosmetic dentistry, I always observe the use of the retraction cord. And that's as well as the rubber dam and the clamp. Well, temporary crown came into kapag gumawa naman tayo ng mga crown and bridges. Yan. Okay. So there are some various materials used in these physico-mechanical methods. Now, we are now entering into this issue, using a heavy rubber dams. We have to know the use of copper bands, aluminum shell, mechanical pack of zinc oxide eugenol, custom-made temporary restoration, modified matrix technique, rolled cottons, and gingival cords. So basically, mga ka-webinar, ito yung lagi nating dapat tandaan when we are dealing with the physico-mechanical isolation. So very simple, but you have to know the protocols and guidelines using this. Okay? Now, at this point, we all know that dentists are one of the most at risk of acquiring COVID-19 from patients. So that's why I will be always reminding everyone, my fellow dentists, my mga kaibigan nating doktor in whatever field they belong, and even to our dear patients, that we have to guard our mouth, because diyan nga pumapasok at lumalabas yung bacteria or yung virus na yan. Sorry, it's not a bacteria, but it's a virus. So kailangan meron tayong pangsanggalang dyan. So again, I am really advocating that with the use of this gargle natin, yung mga mouthwash natin, it's really very important. Before, iniisip lang natin, kahit hindi na ako magmumog, a regular water na lumalabas dun sa ating sa dental chair is enough. But this time, my dear friends and colleagues, we have to be very aware. Choose a better and efficient mouthwash. And then, alam naman na natin yun kung anong ginagamit natin. Basically, and it has been proven so many years ago, na talagang with this antibacterial and antifungal and antiviral mouthwash, I always use this Oranim mouthwash talaga. I trusted it. Okay? So next. So we have to rubber dam. Rubber dam it. So dam it. Okay, yan yung parang sagot nila. So hindi po ako galit. But before we go on what is rubber dam all about, we have to trace where did it came from. Yan. So rubber dam is it's hard to believe that a sheet of rubber can make you feel more comfortable about dental treatment and allow us to do better in dentistry, but rubber dam can. That is from our inventor and discoverer, si Dr. S.C. Barnum of New York. So the rubber dam was first then discovered over more than 120 years now. During March 15 of 1864, Dr. Barnum was first explained its uses, no, during a meeting of Bali in Dental Society in New York City. So dito nag-evolve itong rubber dam that I'm talking about for this whole hour, no? This is the evolution and the development of dental rubber dam. So can you imagine, mga ka-webinar, if without this evolution of dental dam, how are we going to protect ourselves? How are we going to avoid yung cross-contamination of virus nowadays? Talagang nakakatakot, no? That's why they are having a second thought of visiting a dental clinic, because they have to ask first, doctor, do you have this? Doctor, do you have that? So sometimes we are required now to buy and purchase materials, we have to buy and purchase equipment, but sometimes it boils down to a simple thing. Hindi ko minimenos na huwag tayong bumili or bumili, but keep a good oral mouthwash, a good oral hygiene in the clinic. You will be on the safer side this time. Okay, so I'm just reminding everyone that it goes hand in hand with the equipment and machine, and with a good mouth rinsing is always number one. Okay, the armamentarium for rubber dam placement. We did the rubber dam. Kailangan natin yung mga rubber dam sheets. But you should know that rubber dams has light body and heavy body pala. So may makapal at manipis ng mga rubber dam, no? And also, we have the rubber dam frames that comes with large and small sizes. We also have the rubber dam clamps, then the rubber dam punchers, and then the rubber dam forceps. Little by little, alongside of my lecture, I will be giving you some details about what I've mentioned. So what is rubber dam? The dental rubber dam is a piece of thin, stretchable latex or non-latex materials. Meaning to say, kapag latex yan, yun talagang na-expand siya talaga, di ba? At yun namang mga non-latex material, which is not so popular, is that masyadong yung materials niya, no? Medyo matigas ng konti at hindi siya ganong ka-flexible, no? Yan. So that becomes a barrier when applied to a selected teeth. Okay. So it also helps protect the teeth for all types of dental procedures such as root canal, veneers, etc. So there was a question na, Doctor, is it always ba na laging magra-rubber dam for any dental procedure? I should say that it depends on the dental procedure. If you have a long dental procedure that will require hours of work, I think it would be safer to use a rubber dam or a barrier. Pero kung mga quick lang naman, like for example, cleaning, basically oral prophylaxis doesn't require any rubber dam at all. Siyempre naman. But, well, as I mentioned, root canal therapy, veneers, and then mga restorative like class 2 and class 1, we are always required to have rubber dam. For bleaching and preparation of delivery for all types of restoration, so kailangan din natin na may mga barrier. So we need rubber dam. Okay, next is the purpose and why are we using rubber dam? What is really the importance of this? Number one is the visibility. It is much better due to the contrast of colors. That's why rubber dam comes in different nice colors nowadays. Sabi nga nung aking classmate before, sabi niya, di ba Doc, ano lang tayo no, ng rubber dam natin parang kulay blue lang or color green lang. But now we have black, orange, pink, fuchsia, and all that. Mamaya may papakita pa ako sa inyo ng mga latest rubber dam sheets. So it also creates dry and non-contaminated field because the cell and other debris during all banded procedure will be prohibited or being warned, no, na hindi ma-ingest ng pasyente. So that is one good thing, no? And it creates a dry area. So kapag dry and no saliva, no fluid or clavicular fluids, walang contamination or walang virus that could affect each one, pati dentist or the patient. Improves access during dental procedures because it retracts the lip, the cheek, the tongue from the field of operation. Why? Because this rubber dam, when you place it over the tooth or teeth, you would probably have a concentration. When you see and do a certain procedure, when you go get the instrument or the materials from your working tray and then you go back on the tooth, basically you can see that naka-access kayo. Yun agad ang concentration ninyo. No? Yung accessibility, mabilis nyong gawin at matapos because naka-isolate yung particular tooth. Yan. What else? It also protects the patient from swallowing. Yan. As I mentioned, mga non-intentional naman, pag nag-irrigate tayo, lalo na yung mga nag-endodontic treatment, so mga nagtatanggal ng amalgam or old porcelains, yung mga telamsik ng mga nababasag na crowns in composite, it will be prevented to be ingested by the patient. So magandang protection talaga. And increase the efficiency and productivity. Why? Because it reduces the time required for the treatment because nako-concentrate mo agad yung trabaho. When you're working in a class 1 cavity or class 2 cavity and it's being isolated, what happened? Your eyes is always focused on the tooth you are being treated. So napapabilis ang trabaho because isolated siya. And it adds comfort for the patient. Why? For the reason, because it adds comfort because of the confidence of the patient that he or she cannot have the aerosols coming outside, no, from the dentist or dun sa surrounding assistant, na mas komportable siya na hindi niya mai-ingest yung mga hangin or iba pang virus na nakapaligid. And became a classic barrier. Ito yung gustong-gusto ko dito because the rubber dam became a classic barrier for oral health procedures preventing the spread of any form of virus. So meaning naka-lock siya or naka-cover siya sa mouth, di ba? And infection control. That is the bottom line of all of this because without this isolation or without this barrier, we are just like an open kanal, no, na nakabukas sa lahat ng hangin sa loob ng clinic. So we need this rubber dam. Okay, so these are example of rubber dam sheets, no? So we have heavy body and a light body rin. So rubber dam sheets comes with a different colors and flavor. Ayan, may mga flavored rubber dams na, no? It comes with strawberry, grape, banana, mint, and vanilla. So dito kasi mga ka-webinar, the tendency of the patients became less ang kanilang hesitation and anxiety. The moment you place this good dental rubber dam over their mouth, they would be seeing you placing different colors of rubber dam and it's flavored. So they can smell the strawberry, the grapes, the banana. So panalo, di ba? Aside sa na-protectionan nyo na sila, nag-enjoy sila dun sa different colors of those rubber dams. So the dam frames came, it just is to stabilize and to stretch the dam tightly over the teeth. No? This is the one holding the rubber dam na magpi-place doon sa ating ipin. Kaya kailangan ito to stabilize it, to stretch it para ma-proper ang paglalagay ng mga clamp over the tooth. So it comes in plastic and in metal. Both can be cold or heat sterilized. Kailangan yan. So these are example. The rubber dam frames comes in stainless, metal, and plastic. Yan. Ito yung mga sample. Yan. So ito yung mga modern rubber dam frames na hindi naman papahuli tayo because most of the dentists here in the Philippines are really having this mga modern, latest rubber dam frames na. Okay, so what else? So we have a dam puncher. So this is also one important armamentarium in using a rubber dam because you need to punch a hole. So to create a hole in the dental dam needed to expose the teeth that are to be isolated. So the working end of the punch is used to puncture the dam for the correct hole sizes. So you need to have a good forceps, no? Kasi proper instrumentation would result to a good result for a good prognosis or whatsoever. Kaya kailangan natin meron tayong tamang forceps and instrument. So these are example of rubber dam puncher. Yeah. So common na to sa ating mga dentist, but what we are having right now is a review. That's why the title of this is a recall wherein we have to put more importance on this during this pandemic lalo. So another one is the dental dam punch table. This is just basic so that this is just a guide for a dental practitioner on how to make a hole on the rubber dam. So ito yung table, no? If you're dealing with posterior or anterior, you know the diameter that you're going to use. So you have to use the gauge. So what is the biggest diameter to the smallest diameter? So you know where to deal with. Yan yung dental dam punch table. So very important to punch the appropriate hole for the tooth selected for isolation. Okay, so these are example of the rubber dam forceps. Okay, so rubber dam forceps is the one that carries the clamp. Ito naman para wag tumalsik yung clamp whenever you are going to place it over the tooth, no? So another important instrumentation ito. So dapat meron kayo nito sa clinic. What else? Well, this is just looking back during my school days in dentistry in the University of California, Los Angeles, when I took my postgrad training in cosmetic dentistry. I did the studies with the expert, mga head yan of their clinical practices, restorative cosmetic dentistry. And it was really an amazing experience having a postgrad training in the US. Yeah. Okay, so what else? So lubricants. So what is the importance of having this, placing the lubricants over the rubber dam? Why? Because whenever you punch the rubber dam, no, yung rubber dam sheets, and you made a hole already, you should have to stretch it for a while and put the lubricant prior doon sa paglagay ng clamp and then to the tooth. I think most of the dentists watching right now, they know that sometimes they find it some difficulty because when they stretch the rubber dam and place it over the tooth or over the clamp immediately without any lubrication, sometimes it's so hard, no? Minsan napupunit ka agad. It would tear out and then suddenly, sayang lang yung mga rubber dams natin. So you have to put some lubricants on this, okay? Para for ease of insertion ng rubber. Okay. Using the rubber dam for operative dentistry, it gives a practical tips for the dental assistant to simplify the process for a dry field isolation. Again, I'm repeating it because of this Dr. Barnum. It gives us, again, and improve the operative dentistry in so many ways. Kaya thank you kay Dr. Barnum because he discovered this piece of rubber dam and nowadays a barrier to avoid any virus or contamination sa clinic. Kaya salamat sa kanya. Okay, so another one, it gives a drier field, visibility, increased patient comfort, infection. It is just a review na lang. Yan. That's another part of my studies abroad at UCLA. So this is now a simple procedure in performing dental isolation. Prior to this, am I so fast ba, Doc Grace? Okay lang ba? Yan, okay. Kasi kailangan I have to capture the first 30 minutes of my audience, no, ang ating mga ka-webinar kasi baka sila antukin. But there's a lot more, no, pwede ko pang i-share. So this one is a simple procedure in performing dental isolation. Okay. First and foremost, let the patient be in the proper dental position. Ito yung minsan nalilimutan natin eh. So now the dentist is now sitting in front of us. So you have to be aware that he or she must be in a good supine position, dealing with the upper, or when you're dealing with the lower, dapat medyo naka-straight ang pasyente because you are dealing with the lower teeth. And be ready with the mouthwash again. It should be a good antibacterial, antifungal, and antiviral mouthwash before any procedure na mag-start. Okay? So Oranim, I'm using that talaga. So make it a point that all the materials needed must be well prepared, clean and ready to use. The reason for this is that this is a technique-sensitive procedure. If you're going to miss some materials and then you're going to do some isolation procedure and then you don't have the puncher, you don't have the carrier, you don't have the clamp, or one way or another, you're missing something. So it could what? It would result to some disaster procedure. So you will not attain a good result on this. That's why we are here giving you a tip that you have to prepare well the table in doing this dental procedure, especially this dental isolation. So make it the point that you have checked the expiry date of the material, especially the rubber dam. So ito mga ka-webinar, you should know that dental rubber dams has expiration date too. you should know, no, dahil kapag gumamit kayo ng mga expired na dental rubber dams, what happened? There is a disadvantage. Number one, all prepared kayo pero expired na palang rubber dam. It's easy to tear out, no? Mabilis siyang mapunit. Yan. E di ulit kayo ng ulit. Okay? So secure the clamp to be used and must be tied and guarded by dental floss to avoid accidental swallowing. So I always remind dental practitioner that whenever you deal with the dental clamp, you should guard it and tie it with the dental floss so that in case na medyo magkaroon ng konting technical problem when you're holding it with the forceps at natanggal, you can easily retrieve, no, yung clamp kasi nakatali siya. Yan. Then after finishing the dental isolation, carefully removing the dental rubber dams and all the materials used, particularly the dental dams left on the proximals of the teeth. Ito yung isa ko ring gustong i-remind mga ka-webinar, no? Whenever you're dealing with the rubber dam sheets, no, and you place it, because there's technique here that I'm going to discuss a bit on how to invert the rubber dam, and it has to be well adapted on the neck or cervical area of the teeth or tooth. Kapag may naiwanang rubber dam sheets or materials doon, it would create what? It would create perio problem kasi siya yung nakabaon, may naiwanang rubber dams, no? So delikado. So tayong mga dental practitioner, another thing to take note is that when you remove all the rubber dams or the rubber dam sheet, I should say, you should check it before disposing it. You should check kung may nawawala doon sa inilagay ninyong rubber dam. Kasi kapag may nawawalang materials doon, may napunit, may naiwanan sa proximals ng ipin. So we have to be very careful. Ha? So this is a very nice tip for all of us, dental mga ka-webinar natin, dahil kapag naiwanan doon, it would cause what? Perio problem, inflammation of the gums, bleeding of gums, and sometimes would lead to loss of the teeth that we treated. Sayang. And then, let the patient have the final gargle of an efficient mouthwash again and again. Okay? So you know more or less an efficient mouthwash, no? Okay, so listen and always keep those clinical hints, ha? Take this sa mind niyo. Tingnan niyo naman tong Lion King na to, no? Okay, so prepare the materials for isolation this time. So we have the dental floss, the clamp, the rubber dam, and the frame. Yan yung mga importante dito, and the puncher. Okay, tie the clamp with the floss. Why? I explained it already. In order for you to guard it for any accidental swallowing, you can retrieve it easily. Next, mark the area to be isolated. It is number 1 then. So as you see, as what I'm showing you now, I already stretched the dam over my frame, no? Ito yung gusto kong. So I can now mark the area to be isolated. So I'll be isolating a posterior teeth, no? The molar area on the lower. Okay. Use the dam puncher on the mark area. Okay, ayan na yung puncher natin. And then, in doing the punching or doing the hole of this rubber dam, make it a point that it should be cut and clean, no? Walang rubber na maiiwanan. And you have to check it that it should be what? Yung hole niya, kitang-kita. And observe the use of the dental punch table. I showed it kanina. Kung ano yung diameter na dapat gamitin, you should follow that. Okay? Next is stretch the dam and place some lubricant. So before again you place it over the tooth or over the clamp, put some lubricant for an easy insertion and to avoid tearing out of the rubber dam. Simple step lang, ano, mga ka-webinar, because sometimes may mga dental practitioner that they don't really observe rubber dam isolation. But this time, this is the high time for you to have this. Okay. Place the wing clamp over the rubber dam. Okay. Ito mga ka-webinar or to the dentists who are watching right now, I'm using a wing clamp technique, no? Wing clamp is that it is being placed over the dam. No? Ito muna yung ikinakabit ko sa rubber dam before placing it over the tooth. Yan. So maraming question dyan siguro mamaya. Kasi meron technique na nilalagay muna yung clamp sa tooth and then saka inilalagay ang rubber dam. So this one, placing the wing clamp over the rubber dam first. then securing the clamp and bring the rubber dam with the frame over sa pasyente natin. So it should look like this kapag ka ready na. And always check the clamp or the rubber dam and the frame must be secured. No? Kailangan hindi siya gumagalaw or tama ang pag-stretch ng inyong rubber dam na may clamp na. Now, we are ready. The wing clamp now ready to be installed. So this is how it looks like. You will see that the wing clamp is placed with a guided or tied dental floss. Ganyan ang itsura niya. And hold the rubber dam forceps with your palm. Yan, ganyan ang paglalagay and must be at the 10 o'clock or 11 o'clock position. Yan, okay? So ready na to. Start installing the clamp over the tooth. Yan po, nilalagay na natin using what? The forceps or the clamp carrier. Siya yung magki-carry. Now, in case na magkaroon nga ng accidental slip-off, nag-slip yung ating clamp or dun sa forceps, you could easily retrieve it by using and pulling the retraction or the dental floss, sorry. Yan. Secure the clamp, the adaptation without any tissue impingement, and you will see and check the rubber dam sheet and the clamp adaptation. Ganyan po ang gagawin natin, and eventually release the rubber dam sheet from the surface of the wing clamp. Yan. So you see, pagkalagay natin after placing the clamp over the tooth, you have to release on the wing area, dun sa surface niya, so that the rubber dam sheet would envelope the cervical area of the tooth being isolated. Yan, ganyan siya. Okay? So this is how it looked like before installing it, and then kapag naka-install na, it should look like this. So you see the difference? The release of the rubber dam area on the surface of the wing, and then it will closely adapt the cervical area on the picture number 2 after installation. Yeah, that's the whole idea. So it makes a difference now. Hindi lang yung kinabit lang ninyo and that's it. Because you will not get the proper purpose and mission of the rubber dam without releasing the rubber dam dun sa wing area. Okay. So the significance of inversion for rubber dam isolation. First, this is a procedure through which the operator slips the peripheral margin of the rubber dam around the cervical area of the tooth and keep it still during the whole restorative procedure. Meaning to say, parang nagtatak in kayo ng t-shirt, no? Whenever you place it, kailangan nakatak in sa pants, no? Yung ating rubber dam, yung t-shirt. Yan, yun yung pinaka-t-shirt natin, yung rubber dam, no? Yung gums naman natin is doon sa may belt area, which is sa may side ng ating ina-isolate. So I can show you some, no? Significance of inversion of rubber dam isolation. Yan. Ito na mga ka-webinar. We have inversion by air. Meaning to say, upon placement of this rubber dam over the tooth, you have to what? Spray it with yung ating sa dental chair, yung 3-way syringe natin, no? yung water doon. By blowing air into the sulcus, so it is ideal for a supragingival preparation, but it's not working well with an excessive saliva. So it's not indicated also for a partially erupted tooth. So hindi siya indicated sa mga pediatric patient. Ayan. So this is more on for the adult. Okay? Next, another method is using a dental floss. This I concentrate more because sometimes I'm not satisfied using by blowing of air, but I have to make use of a dental floss in order for me to invert the dental rubber dam para lang siya naka-invert siya, no? Yan. Inverted na siya ngayon, makikita niyo by using the floss. Mamaya may technique ako dyan. I'll show it to you. Now, if there's a deep-seated caries or cavities on the proximal area, we make use of Teflon before inverting the dental floss. So another technique. So ito yung ginakailangan nating i-secure, no? That we cannot always use one method over the other. That's why meron tayong pwedeng gamitin kapag malalaki na yung stiripin. Make use of a Teflon. So using this, then finally, you can invert the rubber dam sheet. Yeah. Okay, so it is
Doc
indicated with the air. Yes, yes, Doc.
Oh, Doc Ricky, meron ng tinawag ako ng classmate ko. Doc
Mhm.
Ricky, pasensya ka na, hindi makapag-intay yung nagtatanong.
Okay.
You mentioned a while ago na sabi mo, hindi siya pwedeng pangbata. Alam natin yung reason bakit tayo nag-isolate for the better appreciation of everyone.
Okay. A good question. There are some technique kasi like inverting. No, I'm just talking about the method of inverting the rubber dam sheets or the rubber dam, because yung kaninang binanggit ko using air no to invert it, hindi siya ideal using the air. Doon lang sa mga partially erupted. So meaning to say, sino ba ang may mga partially erupted na teeth? Iba yung mga bata.
Yeah, that's
So may
right.
mga
Oo.
technique
Kaya,
lang, but it is indicated to all patients because pediatric needs rubber dam, no? Naggagamit tayo talaga ng rubber dams sa mga bata. Particularly nga dapat as young age, they should be aware that their dentist is doing and placing rubber dam at their young age. Yun ang importante. We have to start
yeah,
early.
kasi Dr. Ricky, no, kaya kita kinat, ang haba nung tanong niya, hindi na daw siya makapag-intay. Sabi ni Karen Santos, how young po ba or ideal age para ma-check up ng dentist ang bata? Safe ba yan for kids to visit a dentist during this time or okay na muna yung regular toothbrushing and mouthwashing and flossing tsaka na ang check up for the kids? Safety. Doc.
Very good question. Yan ang mga masasarap sagutin. Okay, number one.
Yes.
Kapag sa ganitong pandemic natin, no, still we are on the pandemic na oras natin ngayon, ano, we need not to, no, we don't need to visit the dentist kung hindi naman emergencies. Tama 'yon si Mami na better to have a good oral hygiene, toothbrush regularly, mag-mouth rinsing tayo ng tama. Saka na lang makipag-meet at maggawa ng appointment sa dental clinic kapag okay na tayo because emergency lang talagang ginagawa. The other question is that kailan at anong edad
Yes.
gagamitan ng mga rubber dam ang mga bata, no? Kasi it all depends on what procedure we're dealing with. Okay, ang mga bata ay idinadalaw natin at the age of 3 or 4 at kailangan natin ng mga i-restore yung kanilang mga molars, particularly napakalalaki ng sira ng ipin ng mga deciduous na yan, ano? So sometimes there is a dentist which can be persuasive, no, sa mga bata, nalagyan sila ng mga rubber over their mouth. Kaya nga sabi ko, colorful rubber dams are very useful and attractive sa pedya, no, sa mga pediatric patients. So at the age of 3 or 4, pwedeng lagyan but depends on the procedure you're going to give to the patient. Yun yun.
Thank you, Dr. Ricky. Napakaliwanag ng iyong explanation. In nalo up ni Karen Santos yung kanyang tanong about it. Ang dami niyang question, kaya in-entertain na natin. Required ba mag-swab test before magpa-dentist or visit ng dentist, Dr. Ricky? Sabi ulit
Okay.
ni Karen Santos.
There's really a big intrigue on the swab and the rapid test nowadays, no? Mga ka-webinar and mga mommy, daddy at mga dentist na nanonood ngayon. So siguro it is just like my opinion, no? As long as you know yourself, no? You know yourself. Because we can categorize the patient is this symptomatic and asymptomatic. Napaka-common na yan. When you say symptomatic, you know more or less what is symptomatic. Meron na kayong mga nakikitang lagnat, sakit ng throat, may mga ganyan na. Asymptomatic, they are healthy, no? Kagaya natin. No, the requirements in the dental clinic is strictly talaga naman ng PDA and some organization are really requiring those swabbing or rapid test na yan. Sa swab kasi, it requires time di ba? To wait kung anong alabas ang result. Kung you're going to a dental clinic and you know more or less yourself, kasi kayo din ang mahihirapan. Meron kaming pinapipirmahang mga waiver and agreement doon. Kapag hindi na sumagot yan ng tama, kasi meron kaming mga contact tracing na rin. Before entering the clinic, we have thermal scanner, we have oximeter, you have to write the name, may mga waiver and all that. May mga web teleconsultation tayo. So yung pagsaswab na yan is really an optional for me, but it depends kasi screening So when you come to my clinic, speaking for myself again, hindi ako magsasabi ng ito'y opinion ng iba. This is my opinion. Dadaan kayo talaga sa protocol ng clinic ko and the clinic of some other dentist because yan ang susundin. So the swab test is answerable by the patient itself. Kayo ang sasagot niyan. Do you really need the swab test? Because you know more or less you have. Kung wala naman, papasa kayo saan, iteterma kayo and may contact tracing, yun lang ang magiging sagot natin. It's up to the patient if they wanted to subject themselves for a swab test na yan. So bahala po kayo but keep safe always.
Yeah. Thank you, Dr. Ricky. So, Mami Karen doon sa nagtanong, malinaw yung sagot ni Dr. Ricky. Screening and triaging, ginagawa yan. In fact, tumatawag muna if an appointment is necessary bago kayo pumunta doon sa dental clinic na nabanggit ni Dr. Ricky. If it's necessary and you have to go through screening and triaging. Doc Ricky, tuloy ko na lang din kasi ayaw nilang magpapigil, sabi ni Gloria na matawaran. How often po ba ang paggamit ng dental, I think this is rubber dams, especially for the kids, puro tungkol sa mga bata, and what's the advantage of it? Although sinabi mo na nga, Doc, no? Pakisagot na lang ulit si Mami Gloria de Matawaran. How often po ang paggamit sa dental material, specifically for the kids, and what's the advantage of it?
Okay, so we have to specify muna yung paggamit ng dental what?
Material.
Dental floss or the dental dam?
Yeah.
Ano kaya sabi ni Mami?
I think, Doc, pinag-uusapan natin is the rubber dam, no?
Okay. Sa mga kids kasi, again, I'll be repeating it again, Mami, yung mga nanonood at nagtatanong. So it depends on the procedure, no? Hindi naman natin dapat i-subject lagi yung mga kids for a rubber dam isolation. It depends on the procedure. Pero kapag it really requires talaga na medyo matagal ang gagawing restorative material sa bata, talagang nilalagyan natin ng isolation yan, no? Depende. Kaya lang, this is really a technique sensitive. Kailangan expert yung dentista sa paglalagay nitong rubber dam na to, and the dentist should be well equipped with the materials, no? Yung procedure. Kaya minsan makikita ninyo mamaya later on my lecture, meron tayong mga instant rubber dam. So matutuwa yung mga mami na yan. So there's a lot of technique na po pwede nating pambata naman pala meron na. So that's why alongside of my lecture, no, along the way, see more. And I can answer most probably it later on. So yun lang ang aking masasabi. Depends on the procedure kung kakailanganin.
Okay. Go. Yes, Dr. Ricky, go ahead. Thank you for answering the questions.
Okay, thank you, Doc Grace. Okay, so inversion of Teflon tape is that if the cavities is too big and hindi siya makokontrol ng air and then the dental floss, you need the Teflon prior to the isolation of inversion of the rubber dam. Next is the inversion with the knot ligatures. Well, this is highly recommended technique because this is best indicated when working on a class 2 or class 4 in a different knot may significantly pushes yung pinaka-rubber dam niya into the sulcus. So it's very nice having this practice, but it is again, the dentist should have a good yung practice natin niya lagi ito. Hindi ito yung ngayon niya lang gagawin, and he has to be yung expertise na rin along the way. Kailangan pina-practice. And then I'll just show you some different types of floss ties for rubber dam. Ito po yung mga ginagamit natin. So I'll give it more na lang siguro sa next time. But I'm just showing you a pull tight knot, the loop the floss, pull each end knot, and the overhand knot. Ito yung mga technique ng pagtatay ng floss doon sa ating rubber dam to ensure that the rubber dam will be inverted properly. Na-invert natin. Yan. So, now, ito yung sinasabi ko. We're going to use a clampless rubber dam sheets using this Optradam. Okay, this is an example of isolating anterior teeth. Ito po yung pangharapang ipin ng ating mga pasyente na ginagawa sa clinic, and then it's being isolated with the rubber dam. Ito po yan. So, installation of a clampless, we don't need any clamp at all. So example, this is my patient, this is my setup. So there are 2 rings dito sa Optradam na to. May 2 rings ito that you have to stretch it out before installing to the patient. May dalawa siyang ring sa loob na plastic. Flexible yan. So all you have to do is to take note that before or prior to the installation, there is a table or a dot wherein you can punch the hole on what particular tooth you're dealing with. Yan po yun. May naka-indicate na talaga. So use the rubber dam puncher. So yun. So I'm going to isolate the 4 front teeth. No? Ito yung 4 anteriors na tinatawag namin. So you have to stretch it a little bago ninyo ikabit or ilapat sa ngipin ng pasyente and put some lubricants as well. Then, remove or release the first ring, yung may external ring yan saka internal ring. Yung external ring ang nasa labas, yung internal ang ating ifo-fold. Ayun, finold ko na siya. Finold ko yung internal ring and you have to insert it on the mouth of the patient, dun sa vestibule. Yan, sa corner nung bibig nung pasyente. Ayan, hawak-hawak ko yung internal ring. Yan, ini-insert ko siya para naka-frame na siya doon sa loob. And then the outer ring should remain on the external area wherein it will stretch the rest of the rubber dam. Yan na. So after resting it, you have to stretch yung nakapunch na rubber dam, ayun sa ngipin. And then by using a dental floss and with your assistant, you have to insert the rubber dam into the tooth or teeth. Kita nyo? And then use a dental floss to particularly invert it. Yan yung mga in-explain ko kanina. Process of inversion for the rubber dam to properly place into the cervical area of the teeth or tooth to be isolated. Ganyan ang kalalabasan. Naka-frame na siya, naka-isolate na, at meron siyang dental floss alongside. Yun ang ginamit ko. So, I'm now ready for my dental procedure. And remember, and take this note mga ka-webinar, you see how secure I am and the patient itself using this rubber dam dahil naka-frame outside, naka-protect naman yung internal ring dun sa vestibule or dun sa mouth ng patient inside. So wala siyang papasukang laway or tilamsik ng kanyang pag-umubo or whatsoever because protected ka nitong rubber dam na to. Okay? And then another one is the Optragate. This is also another barrier wherein you are going to use another ring, pero ito wala na siyang double dam. No? It is just a single dam, pero meron pa rin siyang inner and outer ring. You have to compress it, press it over the mouth of the patient, the same way with the Optradam, and then you can isolate the whole mouth, no, yung teeth niya, para sa inyong procedure. And this, it will show you a good isolation. No? So mako-concentrate na kayo sa inyong procedure, protecting yung pagpasok ng iba pang mga fluids and materials over the mouth. So isolated na. So installation of the Optragate. This is my example of a setup. Ito yung sinabi kong you must complete your setup prior to the procedure. So this is a very quick video lang. Ano? So installation of a wingless clamp which I did before. Kailangan natin yan na stretch. Ito, I'm using a wingless clamp. I put the clamp already over the tooth and place the rubber dam over the clamp. And then, I'm now isolating. Ayan na, ini-stretch ko siya using a wingless clamp. See? So, very safe, di ba? And then, you will get the frame. Then, i-floss ninyo para bumaba yung sa periphery ng cervical area ng ipin. And then, makikita niyo yan. You know, mga ka-webinar, no? At sa mga dentist na nanonood, you will learn more on this technique when I'm going to invite you sa Philippine Academy, Doc Grace, no? Kasi maganda siya kapag nakita ninyo yung full coverage of this lecture. This is patikim lang, no? But the Academy is willing to teach all dentists through web what are the other different methods of isolation. Isa lang tong pinakita ko. Okay? So ito naman yung isolation ng anterior on the wing clamp.
Okay. So placement
yan.
of a wing clamp.
Pinunch
So we have to
natin,
do the markings.
inilagay ko yung clamp,
And
and
then I have to
then ito, in-invert ko. Ito yung
more or
release.
less on this side.
Yan. I-release ko.
And clamp.
Yan. Dun sa wing clamp para nakayakap dun sa ipin.
Yeah.
Okay. You will learn more on that sa PAED.
May pa yung ano.
Alam ni Doc Grace yan.
Ito.
Okay? Nag-promote na, no? Okay. So this is another installation for the anterior teeth. I think hindi na masyado tong dahil dun sa mga talagang nag-isolate, they have the idea on what to do in isolating the anterior teeth. Ayan. Kailangan ng assistant dito.
There you go.
This is really very interesting because of this pandemic. You should know on how to do infection control.
Central.
And this is one thing na kailangan nating i-observe.
And then the
That's why I titled it Recall
the
for a safe and
lateral.
virus-free dentistry.
Okay.
Yan. Tapos ipapunch din nyo yan and then you will
There you
isolate the anterior
So,
teeth using a puncher.
Punch each markings using the biggest diameter of the
I explained that nina, di ba?
and make it a point that it's always clean. Okay, and set it to the largest diameter and try to punch a hole.
Nagkaroon ng Dentistry 101 ang ating mga nanonood ngayong hapon na
Patin
ito.
lang yan. Oh, yes. Thank you, Doc Grace. Because
Yeah.
this is really one good thing for all of us to become aware again of this proper dental isolation. But in PAED, we teach more or less extensive procedure pa in cosmetic dentistry. That's why okay na okay.
Yung isolation sa Tagalog, hinihiwalay.
Yes,
Tama?
inhihiwalay. Yes po.
Hinihiwalay. So kanina minimension ni Dr. Ricky habang nanonood tayo, sabi niya, depende kung anong procedure. So pinakita nyo dito ngayon sa different procedures na ginagawa ni Dr. Ricky sa clinic niya. Normally, Dr. Ricky, tama ba ako? Pag nagpapasta ng ngipin, yung sinasabi nating restorative dentistry, dapat
Yes.
may isolation. Pero
Yes.
kung oral prophylaxis o yung tinatawag na paglilinis ng ngipin, pwede o dapat wala muna ang rubber
Wala.
dam
Yes,
pag
that's
nag-oral
right.
prophylaxis.
That's
So
the right.
Dr. Ricky, pwede ba oo, in fact si Eileen yung ating guest from the consumer side, kaya siya sumama ngayong hapon na ito. Eileen, Doc Ricky, ikakat kita sandali Excited
Yes,
siya.
yes, yes. Yes,
She
Doc
has
Ricky.
been an ortho patient for the longest time. I mean, more than 3 years na siya, Eileen. Eileen, pakikwento
Yes.
at pakitanong si Dr. Ricky sa
Yes,
consumer. Yeah, Eileen.
Yes,
Go,
Eileen.
Hello again, Dr. Grace and Dr. Ricky, and to our FB Live viewers. I'm Aileen Joyce, orthodontic regular patient po since I got my braces po. So, ito na din po yung reason behind kung bakit po ako nag-visit ng clinic last week. So, to have my monthly adjustment po. And I remember po yung last visitation ko pa po sa dentist ko is before pa po mag-lockdown. So, I get a chance po na makapag-appointment last week po. So, first thing I did was kinontak ko po yung dentist ko para po i-set po niya yung appointment ko. And he scheduled me 1 week before the day
Mhm.
para po ma-comply ko po yung mga requirements needed po before I enter the facilities po. Then,
Okay.
after po nun is, I make sure po na bago po ako pumunta dun sa clinic na ginagawa ko po yung proper hygiene ko. Like, everyday po ako nagtutoothbrush before I go to sleep and after I eat, after po ako kumain. Then, nagma-mouth rinsing din po ako and I'm using Oranim Terra mouthwash po kasi it helps prevent po sa mga oral infection since naka-braces po ako. And after po nun, nagde-dental floss din po ako. And I make sure din po na kaya po ng immune system ko pag pumunta na po ako dun sa clinic. And yung question ko lang po is, required po ba ang ortho patient na mag-rubber dam po?
Doc Ricky?
Yung ortho. Okay.
Oo.
Yes. Basically, since you are an ortho patient, so you're wearing
Yes.
braces. So it's really difficult for a dental practitioner to put a rubber dam over the tooth with the brackets
Yes
attached
po.
sa ipin, ano? So ang ginawa natin ngayon, ako, no, kasi I'm having also some ortho patient. What I'm doing now is that I'm using my Optragate. So the last yung kaninang pinakita ko kanina, the Optragate is the one that isolating the whole mouth, no? And then showing the whole teeth. Kaya
Yeah.
mas maganda naka-isolate ka pa din. Kita namin what is the activity to do over your teeth. Kaya aside dun sa Optragate or the Optradam, pwede tayong gumamit ng Optragate. That's another form of isolation na hindi naman kailangang i-cover buo yung ipin or the gums kasi isolated na siya. So pwede pa rin pero ibang technique. That is the Optragate. Pwede.
Follow-up question lang din po. How will I assure po na secure po ako totally after po nung appointment ko or adjustment ko dun po sa clinic po?
Okay. So number one, siyempre yung safety mo, no, Eileen, ang talagang number one na issue dito. But well, first and foremost, I always advise and to all the webinar watching right now, no, mga ka-webinar natin, lagi talaga tayong maging aware na sa pagpunta ng dental clinic, meron tayong mga screening na ginawa, na mention na rin ni Doc Grace kanina, protocol na yan. At kapag nasa loob ka naman na ng dental clinic, patients are also required to use PPE. No? May naka-PPE rin sila. Why? Sabi nung iba, there are some thought that bakit sila mag-PPE pa kung ang clinic naman equipped na ng mga aerosol machine, mga defogger and all that. Well, it's still an added infection control pa din yan. So wala namang masama sa nag-iingat kesa dun sa magkakasakit ka. And of course, before and after, talagang yung pag-gargle talaga is my number one priority. Before my patient open his or her mouth, kasi pag tinanggal niya ang face mask niya sa upuan, no, sa dental chair, ako yung naka-face mask, ako yung naka-face shield, siya ang mag-o-open ng mouth. So what is now what is the purpose now? Magpapatingin siya ng ipin. So ibubuka ang bibig. So the moment the patient open his or her mouth, let the patient have a good oral mouthwash. Yang rinsing na yan. That's why, sabi ko nga, the Oranim is also very helpful because talagang yan yung pampatay ng mikrobyo at mga virus sa mouth in a regular use. So before and after procedure, I require a good mouth rinsing.
Yes. Thank you,
Doctor,
Doc.
di ba po?
Yeah. Yes, Eileen. Go ahead. Yes, Eileen.
Advisable po ba yung tawas since pag naka-brace po is prone po talaga sa mga mouth sore po and oral
Yes.
infection?
Basically, ang ano natin, marami na tayo ngayong mga medicaments, no? Very friendly na ang ating pharmaceutical industry because they provided a good mga panglagay natin sa mga singaw, no? Sa ating mga lesions sa mouth, sa bibig natin. So that's why you can always look for a good medicine or a good mouthwash na rin. At isa nga yan, no? Because Oranim can also be of use, no? Kapag kami mga lesions at singaw tayo. But there is a particular medicines that we deal yung mga singaw or soreness natin. So talagang nagkakaroon tayo ng mga ganyan, mga soreness. Especially sa mga kagaya mong naka-braces. Kaya we have to be very careful, ha? So meron tayo dyan na may mga mahuhusay na pangtanggal, alis ng mga singaw at mga lesions and soreness sa ating gums and mouth natin. Meron tayo. Okay?
Yes, Eileen. Nasagot ni Dr. Ricky ang mga katanungan mo na
Yes,
so
po.
happy ka na, I'm sure, Eileen. Napaka-very good ng ating pasyente na guest ngayon, Dr. Ricky. Lahat ginagawa niya from toothbrushing to mouth rinsing and tama ba nagpo-floss siya kahit naka-braces siya? Although may specific naman talaga for
Yes, we have a dental flosser.
Yeah.
Sa mga naka-braces, we also have designed a good floss kasi hindi nga naman papasok yun from the top, no? So
That's right.
ipapasok natin yan doon sa proximal area using a dental flosser.
Yeah.
Yun.
Yes,
Make
po.
special floss ang mga orthodontic patient talaga. Meron.
Meron. So Eileen, I'm sure na satisfy ni Dr. Ricky yung mga katanungan mo. Tama ba, Eileen?
Yes po, Dr. Grace.
Oo, so very
Thank
good
you.
girls. Eileen, thank you sa pag-share mo sa atin ng iyong dental visit experience. Follow-up question lang, Dr. Ricky, by
Sure.
Angeline Balbayra. Bawal po ba magpabunot ng ngipin pag mataas ang blood pressure?
Yes, number one, kasi before naman natin hawakan ng mga pasyente ngayon, especially if they're going to subject for a dental extraction, first and foremost, you should know the history of the patient prior to the injection or subject them for any surgery. So doon pa lang mai-screen na natin if they are having, taking up medicine for high blood, diabetic, meron silang mga compromised health status. So bawal na bawal po kapag ka ito ay magpapabunot, they need to secure a medical clearance and certification first sa medical sa medical because kailangan nating proteksyonan ng pasyente and at the same time the dentist itself. Kasi mahirap baka sa dental chair pa siya abutin ng atake, it's so hard, no? Wag naman po. So bawal magpabunot yung may mga high blood pressure na yan, iko-control, yes. Kokontrolin, secure a medical certificate first, and then go back to your dentist and show your certificate that you are allowed to have the dental extraction procedure to be done sa inyo. Be safe po lagi.
Thank you, Dr. Ricky. So we are in partnership with your medical doctor. So seek your medical clearance first sa
Correct.
inyong IM, family med, diabetologist, cardiologist, para hindi naman makompromiso ang practice ni Dr. Ricky. Di ba, Doc Ricky? At
Yes.
tapusin ko pa tong isang question kasi related siya, tooth extraction from Jasmine Angelic. Sabi niya, pag po ba masakit ang ngipin, Doc Ricky, bawal po ba magpabunot?
Okay. Depende po yan, ano? Kapag ang pasyente ay nagko-complain na masakit ang ngipin, i-check po namin mga dentista yan kung namamaga, no? Kasi kung may pamamaga na, ibig sabihin meron na po siyang abscess sa loob. So pagka may abscess na yan, kahit na anong dami ng anesthetic solution that we're going to introduce, still the patient would feel the pain, no? While removing it. Yan po yung mga reason why we do not extract ang isang ipin kapag namamaga yung surrounding tissue or gums. Hindi po tatalab talagang anesthesia because yung pong nana ang nakapaligid doon sa puno o ugat ng ngipin. So we have to let the patient take some antibiotics and pain reliever first. Kapag ka nag-subside na po ang pamamaga, pati pagsakit ng ngipin mawawala. But remember, kapag nawala na po ang sakit ng ngipin, wag na po naman kaming kalimutan. Bumalik sa amin at ipagamot na yung ngiping sumakit. Dahil kung hindi, uulit-uli ang pagsakit ng ngipin. So we have to solve the problem properly with the proper protocol in the medical and dental aspect po.
Very well said. Salamat, Dr. Ricky, sa paglilinaw ng kaso na pagdating sa masasakit ng ngipin. So, last question, Dr. Ricky, bago mo ituloy yung iyong presentation, sabi ni Mr. Rene Arganda, Dr. Ricky, what is the difference? What is the difference? How dentists sanitize and disinfect the device and equipment now compared to before pandemic? So ano daw difference nung pagsasanitize and disinfection ng ginagawa ng mga dentista sa mga equipment and devices compared before the pandemic at saka ngayong meron ng pandemic?
Wow, that is a very good question, no, coming from our viewer. Thank you. Okay, before the pandemic naman came, no, as a dental practitioner, we really observe good disinfection sa clinic. Alam natin yan. Why? Because even without this COVID-19, we, on the dental profession and even in the medical profession, talagang aware tayo sa invasion ng bacteria and viruses. So kami po, nung bago pa mag-pandemic, ang aming disinfecting procedure ay very rigid. No? Ang amin pong mga autoclave machine na kung saan ang mga dental forceps, materials, kailangan po talaga naka-autoclave. May mga UV sterilizer kami. And ito po ang maganda sa dentistry ngayon. Basically, tayo ay...
Isolate.
Wala ako.
Meron, Doc Ricky. We're hearing you, Doc.
Okay. Sorry,
Meron.
sorry. Meron. Okay. Ah,
Meron, Doc Ricky.
okay. So ngayon, ang mangyayari lang sa atin ngayon is that we are really making a triple approach for a more disinfecting procedure. So doon sa nagtatanong, paano namin dinidisinfect at ini-sterilize? Kung noon po ay wala pang COVID, sobrang ng rigid ang aming sterilization. This time, naging triple ang aming pag-iingat, even disinfecting our aerosol machine. The one which deals with the aerosols, yun po yung mga UV HEPA filter, mga misting machine, and at the same time, we also have some, what else? Ano pa ba yan? Yung ating mga machines and equipment. So, naging triple po tayo sa atin pong didisinfect ng mga gamit na gagamitin sa bibig ng mga susunod na pasyente sa clinic po. So, ganun pong ka-aware kaming mga dental practitioner. Yan po.
Thank you, Dr. Ricky. Actually, we salute all the dentists who decided to go back to dental practice, braving the pandemic despite the high risk of all dentists. Kasi nga, the mouth is the entry, the biggest gateway to virus and bacteria. And yet, you decided to go back to practice. Saludo kami sa inyo, Dr. Ricky. So, follow up ni Mr. Rene. Sabi niya, Dr. Ricky, last na lang po talaga for a dental expert like you. Is there an ideal way to gargle to maximize mouth rinsing? So nabanggit natin, Dr. Ricky, na part na ng CDC, yung sinasabi nating Center for Disease Control and Prevention, mouth rinsing is a must in any dental procedure before we proceed to a procedure. So meron po bang ideal way to gargle to maximize mouth rinsing?
Okay. There's a lot of procedure to follow, no? It depends on the literature of a certain mouthwash or gargle na ating mga ginagamit sa clinic, no? It depends on the literature. But for me, the standard way of rinsing our mouth, no? Number one, first and foremost, at least dapat hindi na siya diluted, no? It should be in a concentrated manner. Hindi na kailangan lagyan. Kasi ng karamihan tanong Doc Grace, lalagyan pa po ba ng tubig ito para po i-ano? So to get and obtain the maximum strength and yung efficacy ng isang mouthwash, no? Tayo po pwede naman nating sabihin sa pasyente how much they're going to do sa gargle, no, sa pagre-rinsing. Sa akin kasi the Oranim, I mark yung bang cover niya mismo. It's really nice yung packaging, no, kasi it's just like a small cup pag binuksan ninyo yung Oranim, no? So pag nilagay mo yon, at least mga ilang inch lang, no? And then pinapalagay ko yun sa pasyente, and then I let the patient do the mouth rinsing, no? And then leave it for a few seconds or more or a minute na kailangang umikot siya at maglaro, no? On the whole round of a minute or so para doon sa lalong maging efficient yung paggagargle natin. So yun ang sa akin na standard. Kasi minsan may very strong yung kanyang alcohol, but I know that Oranim is organic in material. Kaya kahit na minsan nga nai-ingest ng pasyente, it's still very safe. That's why talagang yan yung madalas ko ring i-recommend sa patient. And I find it so efficient and effective sa aking mga pasyenteng gumagamit nito. So yun yung sa aking standard, no? To attain the efficacy of that mouth rinsing.
Thank you, Dr. Ricky. Talaga namang masasabi natin you are such a blessing to everyone sa dami ng binigay mo ng information sa atin. Meron pa po bang kasunod ang slides nyo, Doc Ricky?
Yes, I think that's
meron kadaming question dito. I cannot resist but ask.
How can I go back? I have to screen share again. Meron lang akong last na doon, sa screen share. Yan, matatapos na to mga ka-webinar, no? Then I can entertain some questions.
Ang nagtatanong, Dr. Ricky. Kaya...
Talaga? Sige. Okay. So after this slide, okay, yun na yung huli, no? So I just made an isolation for the four anteriors. So in conclusion, the rubber dam was introduced in 1864, And then since I just already did a good introduction, it improves clinical visibility in ensuring contaminate-free surface that have been proven on numerous elucidated studies. So talagang pinag-aralan lahat yon. A simple dump placement protocol for every procedure will give a support successful long-term outcome in restorative care. Though repetitive use, clinicians should be able to achieve a complete isolation in less than 3 minutes. And most importantly, ito yon, eliminating the most common reason for not using a dental dam is making us more aware of cross-contamination for a virus-free and safe visit to dental clinic, and so therefore will help us promote a healthy dental practice. So that's the parting words that I should say, the importance of this rubber dam placement. So these are the references I made. Hindi po natin kinuha yan sa tabi-tabi lang. It talagang nag-survey tayo and we read books and texts, no, to have this good lecture material. So meron tayo ditong kasabihan. Instruct a wise man and he will be wiser. Wiser still. And teach a righteous man and he will add his learning. So yung mga shinare ko sa inyo, it could be like ngayon nyo lang narinig, but eventually along the way, going to the dental clinic, going to the medical clinic, you would observe the proper protocol and in order to observe the practice of a safe and virus-free dental visit. So again, thank you very much. Before tayo magsagot ng mga maraming tanong, thank you very much, Pharmacia Jimenez Corporation, Dr. Grace Calilong Jimenez. Salamat, classmate, sa iyong pag-invite sa akin, and the rest of the Pharmacia Jimenez Corporation. But salbantalahin ko na to before na malimutan ko, no, dahil magtatanong sila. The Philippine Academy of Aesthetic Dentistry, an affiliate of the Philippine Dental Association, invites you all. PAED Aesthetic 101 NCR Batch 35, malapit na po. Experience the first online blended learning on this coming November 2020. So for more details, call Dr. Gigi Cruz, the PAED President, Dr. Maylene Egrubay, the PAED 101 Director, and yours truly, Dr. Ricardo Gatbonton, the course coordinator for this batch. So ayan po yung aming mga contact number if you wanted to know more. Pakipicturean na po yung screen, mga dentist na nanonood ngayon. And maraming salamat again for this opportunity to share. That's all. Thank you. Now we can entertain some questions. Dr. Grace.
Okay, saan ka pwedeng puntahan at makontak dun sa mga nabitin sa pagtatanong kasi sumobra na tayo ng 1 hour.
I know. So I think you can send message Dr. Ricardo Gatbonton na naka-flash naman sa screen kanina, and then you can send a message for some questions and inquiry. I can be of help to all of yung mga questions pa na gusto po ninyong malaman pa for a safe virus-free dental visit. I'm willing. And malay Dr. Grace, no, magkaroon pa tayo ng part 2 nito. Kasi talagang napakalalim pa, we can explore more this infection control. Okay?
Yeah. So,
Thank you.
salamat Dr. Ricky sa pag-discuss mo ng mga CDC recommended infection prevention and control practices sa bagong new normal sa dentistry. At wag natin pong kalimutan, screening and triaging is still as a must before we see and go to our dentist and visit their dental clinic. And higit sa lahat, protect your immune system para po tayo ay laging may panlaban against bacteria, virus, and other infection. Dr. Ricky, hindi ko na po pwedeng itanong yung mga tanong like tanong ni Jenny Collado. Dediretso na lang po sila sa intro dahil nag-overtime na po tayo.
Yes.
Tandaan po natin yung sinabi ni Dr. Ricky na pwede po kung saan po siya pwedeng makontak para dun po sa mga ibang gusto pang magtanong. Yan po mga dear viewers, marami po tayong natutunan tungkol po kung paano natin ma-ensure ang ating mga safety measures na dapat obserbahan pag bisita po natin sa ating mga dentista at pagpunta natin sa mga dental clinics. Ano po yung mga safe at virus-free na dapat nating obserbahan at pinakita lahat ni Dr. Ricky through isolation o paghihiwalay pa kung anumang procedure ang dapat nyong gawin at ipagawa sa inyong mga dentista. Sana'y natugunan ni Dr. Ricky at I'm sure he was able to actually address all those worries and cobwebs sa mga minds natin kung bibisita ba o hindi bibisita sa ating mga dental clinics at sa ating mga paboritong dentista. So Dr. Ricky, it has been a very productive afternoon with you. It was such a delight. It was such a treat. I call it Dentistry 101 again, and wearing my gown in a dental setup refreshes me again yung ating school days back in the dental school. Salamat Dr. Ricky for your time.
Pleasure is mine. Thank you so much, Dr. Grace.
We appreciate you for sharing all your talents and your expertise. So sana maulit po ulit. Salamat Miss Eileen sa iyong time din sa pag-share mo ng iyong mga best practices as a patient. So maraming salamat po Dr. Ricky, Eileen.
Welcome.
Yes po, thank you.
Yeah, sa regarding sa ating topic next episode, aalamin po natin ulit, mag-i-invite po tayo ng isang resource expert na magsasalita po tungkol sa pagiging active after the quarantine, kung safe na po bang bumalik, kung safe na po bang magkaroon ulit ng outdoor activity. So abangan nyo po yan. It's gonna be another exciting and interesting episode next week po. At sa mga interesado po sa ating mga produkto like Oranim and Nimit Alcohol, you can visit our website at www.farmaciajimenez.com. You can also buy our products sa mga leading drugstores like Southstar Drug, Generica Drugstore, the Generics Pharmacy, at of course sa Mercury Drug and authorized provincial distributors nationwide. We will see you again next Saturday via FB Lives for another episode on nutrition and health webinar series brought to you by Farmacia Jimenez Corporation. So remember always, feed your faith, not your fears, and keep living. Good afternoon po sa inyong lahat.